be going inside the psychology of plastic surgery with women who've tried to improve their self-image and their self-esteem by going under the knife. Well, my next guest is Enid, and after having a baby 8 years ago, she says she let her body go and she wasn't taking care of herself anymore. She once exuded confidence as a model, but she says the change in her self-image has caused her to feel self-conscious. Take a look.
When I was a model, I was a 34B. If I walk into a room, definitely people would kind of look because I was tall and slim. I didn't have to ever wear a bra when I was modeling. They were all in the right place. And then I had the baby, and then my breast fell. Ever since I had my child, who's 8 now, my breasts never went back to where they were before. They changed dramatically. I think it's a constant reminder that you're getting old if you don't look that great. I think it has hurt my confidence in some ways. My husband thinks I'm sexy, but I don't think I feel like I'm sexy. And if I can try to fix something that needs to be fixed, I think, more than anything else in my entire body, I will do that.
Okay, now Enid allowed us to follow her throughout her whole breast reduction surgery, and we were able to see firsthand how someone psychologically prepares themselves for that kind of procedure. Take a look. Hi, good morning.
Hi, doctor.
So you're ready?
Yeah.
Are you nervous?
Yeah, I'm nervous. This is actually good because this is calming me down talking to you.
You have a psychiatrist of your own on the way to your plastic surgery.
It's kind of nice.
Maybe this should be a trend. Now, what would be a grand slam home run in terms of this surgery?
I just want to be comfortable.
Does this have any resonance in terms of your relationship with your husband?
I'm the one that has the, hang up here. I mean, because I feel like I'm not really that sexy.
I've talked to other women who tell me, like, you have these thoughts, the night before, like, will I learn that for vanity's sake I, altered the course of my life? What if things don't go well?
I guess it's worth some amount of risk.
So we'll see you after this surgery?
I don't think I'm saying that I do the right thing, but I'm feeling like I don't know what's going to happen. I hope everything goes okay. Okay, here we go. I'm nervous about this having, them do the surgery.
Good morning.
Good morning.
How are you doing? Nice to see you. Why don't you just tell me again this morning exactly what it is you want us to do?
Yep. I want to you get them as flat as possible.
All right.
And as small as possible.
Something that's really appropriate for your body, but lifted and better shaped?
I guess so. I mean, I really just didn't want to be flopping around anymore.
Check the markings, did our final measurements.
I'm just feeling nervous.
The surgery is going to take approximately 3 hours. We'll get started here. Bilateral breast reduction.
To have a good sleep, you may feel a little bit of burning in your left arm as you go off to sleep. That's completely normal.
So today I'm going to make her breasts smaller, lift them up, and we'll do that by making a new skin brassiere and removing a portion of the breast tissue. At this point, things are starting to get bloody.
Okay, please welcome Enid. You're on your 4th day, right? It's 4 days ago you had the surgery.
Yeah.
Amazing. I mean, how do you feel and how was the recovery period? You're still in the recovery period.
Still in recovery. Still, on the medication to numb, the pain a little bit.
You're a psychologist, by the way.
Yes.
So you must have considered the impact potentially on you psychologically before you had the procedure. What did you want?
I think I want freedom. I think I felt very much a hindrance in the sense that I wanted to become more athletic. I love to ride horses, and I want to be able to do more rigorous exercise now and on a regular basis. And I couldn't very well because of the size of my breasts, and it was very difficult to even do yoga or things that
exercise. Mm-hmm. What about men? Are you aware of men, whether they're looking at you or not? You were a model. And you're so beautiful, but you said that this part of your body didn't go with that physique.
Well, I mean, I don't know if I don't think about
you're
that
married,
so much
I get that, but
anymore now.
let's talk about your husband. Does it matter if he's more or less attracted to
Yeah,
you?
oh sure. I think that it definitely, if I feel better about myself, sure. I think
And you
it's
would
going
expect he'd feel better about you. Okay, so you're 4 days post-recovery. Is there a feeling yet, or do you anticipate that there might be a feeling like if it goes well, maybe now I went through it and it went pretty well, maybe now, I can't think of anything for you, but do you have that or no?
I don't.
You're done.
I'm done. Yeah, this is all I wanted to do, and really for some time now, ever since I had the baby, and my physique changed pretty dramatically from what I was used to early on, or most of my life. And then this is really the only thing that I wanted to.
And this is a different goal that she had, which you can tell. She had a definitive goal. Who would withhold this from her necessarily, right? Her husband's on board, she's on board, she says she wants to be more active. Okay. I mean, the psychiatrist gives it, a clean bill of health. Up next, we're going to meet the doctor who performed Enid's surgery. We're going to find out what he has to say about our other guests as well. What went wrong, what went right? Stay with us. Joining us now is board-certified plastic surgeon Dr. Sherrell Aston. He's considered one of the foremost international experts in aesthetic plastic surgery. Okay, Dr. Aston, you performed Enid's surgery. When you do that, in the preparatory phases, what are you listening for as to whether someone's an appropriate candidate? Because we have some people here we're going to ask you about who you may have thought, I don't know.
Well, Enid came in with a very specific request. She was motivated. She could describe exactly what she wanted to have done. And she seemed that her self-esteem was very good. And she said that today. And it was obvious to me that doing the proper operation for her could help restore the size of her breasts, put the breasts in the position that she had earlier in her life, and I thought we could make her very happy.
Now, I noticed on the tape, she says, make them as flat as possible, and you don't respond, which I figure means that maybe you're thinking, well, I've heard this a lot, and yet there's a balancing act to be done here in terms of how much we're going to do.
Yes, well, we actually discussed that, and I said we need to make your breast proportion to your body. It's got to be the right size for you. Okay.
You were listening backstage to these women's stories. What are some of the red flags that a plastic surgeon and thereby that people listening at home might hear in their own presentation? What do you watch for to say, I don't know, let's go slow or let's not do this?
Well, let me say at the outset, with shows like the Extreme Makeover, the Swan, where patients are having numerous procedures at one time, the person who's the best psychologically balanced person in the world could have a difficult time getting on with it.
Yeah.
Now, La Paula's husband expressed the fact that the real problem was with him. La Paula said she was happy with the result. Once he came around, and he said it was about a year later, then they seemed very happy with it, and they both said they would go through it again.
Okay, and how about Lori? Because if we did this together, I would be coming to you and saying, she has a lot of expectations about this.
She should have had significant psychological counseling before surgery. She admitted that her self-esteem was very, very low. And a good board-certified plastic surgeon, on hearing her story, would have said, let's not do the surgery yet. Let's get some help so that you feel better about it. I know I can do a procedure or procedures that are going to make you better, but let's make sure that you're psychologically well-balanced.
All right, now help Heather, Lee, and Monica, because if they were to come to you right now, you've heard their stories, and if they were to say to you, doctor, please, with your international reputation, surely the surgery we have with you will complete our transformation. When do we start?
Well, I could help them okay. I would say no more surgery. They both need psychological counseling.
And you have said so as well. And we may well have you guys back on the show to look into what is driving you toward these surgeries. Are there people who persist who call you and say, come on, why would you turn me away? I'm just wondering, you must get into sort of relationship issues in a way.
Sure, I've certainly had that experience. And I think it's my job to counsel the patient and say, I'm just not going to do it. And I advise you not to seek someone else to do it, because it will happen. There's a lot more involved in the result of a surgical procedure than just the actual physical result when it's done. The patient's perception of their problem in the beginning,
right?
And does it have any symbolism to them? In other words, is this mother's neck or daddy's nose? Is it okay if I get rid of it? And then what is their real motivation
That's really
for surgery?
Important. I think that's so important.
And after the motivation for surgery, what do they really expect? And when I say what do they expect, not just the surgical result, but what do they expect in their overall life? Because as we've seen in most of these people, that the results of surgery influence family and friends.
All right, stay with us. We're going to hear more.